magnetics, and I've been doing magnetic therapies since 1989, 1990. I originally started working with magnetic medicine because I was trying to find a way to do acupuncture without needles, because in 1990, acupuncture was just really beginning in this country, and people were still needle phobic. So I started working with static magnets, realizing that in the Orient, people were using magnets as acupuncture on acupuncture points. And then, as a physician, I was trying to validate the science with the magnetics so that I could apply it in medicine and convince my patients. I was never trying to convince my colleagues. I was always trying to convince my patients. I gave up trying to convince my colleagues a long time ago. And when you have ADHD, you hate keeping to go back to try to bring people back to where you are, because if you're 10 years ahead, I started using zinc lozenges 10 years ahead of everybody else, and of course now, the science is showing us that it does work. It is tough being 10 years ahead of everybody. It's even tougher, I think, being a century ahead of everybody. We do have our book, Magnetic Therapy in Eastern Europe. It's a summary of a lot of studies that were done in Eastern Europe. They were so far ahead of us, but unfortunately all that research was in Russian or Czech or Polish or whatever. So we summarized a lot of that. That book's available at the Body Fields stand. You can get it from them. Part of my sort of joie de vivre and reason for doing what I do is to be able to educate people about it. So I set up a website, drpawluk.com. You're free to use it. It's primarily an educational website. We hope to be able to actually become self-sustaining at some point in some fashion, but right now it's just the beginnings of what we're trying to do. Jim already talked about the fact that the Earth's a magnetosphere. Our total biology is evolved inside a magnetic sphere, and we're affected by it every day, whether we like it or not. These are at least some of the mechanisms of magnetic fields and how they affect us biologically. So I won't go into those again. Jim covered those. These are some of the terms that we use. Tesla, millitesla, it's very confusing. Most of the scientific literature is in the terminology on the left: Tesla, millitesla, microtesla, etc. This is a translation of some of those units. 1 Gauss is equal to 1/10,000th of a Tesla, or 1.1 millitesla. So it's a very, very tiny unit compared to what we're dealing with MRIs, for example. Field lines around magnets. This is the kind of configurations that you get with electrical fields or magnetic fields around wiring. So when you start to create electromagnetic fields, the field configurations become astoundingly complex. And physicists, engineers that calculate all these fields and know what to do with them. Basically, the right-hand rule is anywhere you got a wire, you got a field. Anywhere you got current, you have a field. Acupuncture points, acupuncture meridians, Bob Becker showed this, right? My namesake Pawluk did a study that demonstrated that acupuncture meridians are DC current systems. Now, they're more than that, but they at one level at least are a DC current system. So basically, you're taking a wire and you pass a current through that wire and you produce a magnetic field around it. I've been trained in acupuncture, homeopathy, hypnosis, Reiki, all kinds of healing systems and so on. So I've tried all these different technologies. The one that I've been using on a consistent basis that seems to resonate, pardon the pun, with people in my practice, people who are willing to accept these new concepts beyond acupuncture, is the magnetics. So most people can begin to relate to it. Fortunately, for us, Niken has done a tremendous sort of publicity blitz of our society. And now when you talk about magnets, just like when you talk about acupuncture, people nod their heads. They don't necessarily know much about it, but they nod their heads at least. When you start to look at magnetic concepts for applying it to healing, you have to consider a tremendous number of variables in the design of the magnetic fields and systems. One of the key principles about magnetics that you have to know is, whether it's static magnets or electrical fields, is that they drop off extremely rapidly with distance. So if you take a 250, if you take 250 Gauss magnet and you go out 5 centimeters, you're down to 1 or 2 Gauss. So you see, you lose a tremendous amount of field in a very rapid period of time. Once you reach down to about a half a Gauss, you're basically ambient. So that means static magnets stop working. They don't work any longer when they reach a half a Gauss, because now you're part of the background field. Right? So their effectiveness is very limited and very shallow in the body, and I've struggled with this a long time when I work with magnetics, and yet you see a tremendous amount of effects from the use of static magnets on the body, but most of that is going to be in the local tissues. That's why they're great for wounds and skin, and then secondarily through the reflex systems of the body. Now the same principle applies to pulse magnetic fields, but the difference between a static magnet and a pulse magnetic field is that because it's pulsing, it's interacting with the tissues at a level that it has to be higher, only higher, in my mind at least, it has only to be higher than the pulsating fields, or the strength of the pulsating fields within the body itself. Because the static field is ambient. Actually, there's one interesting study I read that said pulse magnetic fields don't work without a DC field. We will not be able to get any kind of benefit from the electrical fields that we use or the pulse fields that we use unless we are on the planet. So if we leave the planet, I'm not sure what happens with pulse fields. It's transparent to a magnetic field. Now that again depends on the frequencies. So when I make this kind of statement, it's because most of the time I tend to work with ELFs, extremely low frequency fields. The wavelength of a 3-cycle field, a 3 hertz field, is meters long. It's very, very long, so it just moves right through the body without any obstruction, essentially. Even through bone. I educate my patients basically saying that. A lot of phenomena in the body that are sensitive both to the field itself, in other words, that they are sensitive to this Ersted's or the Gauss, the strength of the field. There are a number of phenomena in biology and in the body that are gradient sensitive. In other words, how quickly does that magnetic field drop off or change with distance. So when you put a static magnet on your arm, right, there's a tremendous gradient drop. Now across the cells, if you can imagine, if one cell is exposed to the full strength, the cell next to it has a log difference less than the cell next to it, and so on all the way down the line. What happens with charge characteristics across those different cells? Okay, being all essentially electromotive, and as Jim said, 90% of the molecules in the body are polar, which means that 90% of the body is electromagnetically active. Okay, my simplistic concept of this, again, in terms of educating people, is basic physics. You move a magnetic field past a conductor, or you move a conductor past a magnetic field. What do you get? Charge. You generate current. You generate electricity. So a huge amount of the impact of pulse magnetic fields in the body and static fields in the body is due to creation of charge. So, and again, we all agree with this, right? The body is just a big bag with many little bags of electrolytes. The body is a big battery. It's a huge battery. Very powerful battery. Magnetic fields are graded in terms of responsiveness in the tissues, again, based on whether they're static or pulsed. The softest, the easiest, the most gentle magnetic fields in the body are the static magnetic fields. The most pronounced are the alternating fields or pulse fields. Sinusoidal fields tend to be a little stronger than some of the square wave fields, but basically anytime a field is pulsing, it's creating activity within tissue. Static magnets tend to be more parasympathetically active, and time-varying fields can be both parasympathetically and sympathetically active, so they can use either one. In our book and some of the research from Eastern Europe has basically said that severe acute conditions, you tend to use statics, if anything at all. But for chronic conditions, time-varying fields tend to be better. They tend to create more dynamic activity and moving things by virtue of the creation of charge. In the body, again, when you apply a static magnetic field, except for the time that you're slapping it on, that you're actually putting it on, where you create a magnetic motion into the tissue, okay, so that's time varying as you're doing that. But once it's actually applied to the tissue, now the magnetic field is not in motion anymore. What's in motion is the body. So all the other stuff in the body is moving. Lymph, blood, even the electrolyte flows within the muscles, etc., are moving. Muscles conduct current. When you move a muscle, muscles conduct current at the rate of something like 30 meters per second. It's extremely rapid. So when you start creating that motion under the magnetic field, you create charge. But it's a small amount of charge that you're creating because you're depending on the continual motion of the tissues themselves. With a pulse field, you have that continuous motion of the tissues, but you also have on top of that the very dynamic action of the frequency field itself. So you have a multiplicative effect with pulse fields that you don't get with the static fields. From James Oshman's books, healing energy, whether produced by a magnetic device or a medical device or projected from the body, is energy of a particular frequency or set of frequencies that stimulates the repair of one or more tissues. So the concept, again, with pulse magnetic fields is that using frequencies then to interact with the frequencies of the body, the electrical charge processes of the tissues to generate a healing response. Some of the earliest approved magnetic devices were actually approved because they do generate charge in tissues to stimulate bone healing processes that get stuck. The body's own systems get stuck. There's not enough energy in the body to create a bridging of that gap. When you introduce a pulse magnetic field system, then across that gap or into that bone, you start to stimulate bone formation. There's something like an 85%, 70-85% healing rate in non-unions, even if the gap is almost a centimeter. If there's no bone, as long as you have periosteum, you will bridge that gap. The people using these FDA-approved bone healing devices are wearing them 12 hours a day, and they could wear them for a year. Some of them they only wear for 3 or 4 hours a day. Some of them they actually wear for 24 hours a day. And again, a big part of the cause of this, or the reason for this, is that as the pulse fields move back and forth across cell membranes, they generate charge differences across the synapses. They start to move those charges back and forth. Magnetic fields in and of themselves are not charged. So you can't say it's a phenomenological thing. A positive magnetic field is not the same as an anode or a positive charge in electricity. It's just not the same thing. You cannot equate it, and that's a huge point of confusion for people who are looking at this, particularly from the lay public. As you sweep fields back and forth across the membranes, as they go back and forth, they sweep across these membranes, they generate a whole lot of activity in the cell. One of the things they do is they change and they really re-equilibrate the charge differentials at the membrane itself. So you can have a stack up of positive charges on the outside of the membrane and a minimal amount of negative charge on the inside of the membrane. The reason is the membrane channels have started to close down. So calcium does not move adequately in and out of the cell. Once you subject the cell membrane to a pulsating field, a magnetic field, then what you start doing is you start opening these channels. We start opening channels, then charge carriers begin to equilibrate across the membrane. The membrane becomes normal, the membrane becomes softer, and it's not only the calcium channel. Now all the protein channels, all the carbohydrate channels, all the lipid channels, really the whole membrane essentially softens up. Things start to move and they open up. That's one of the reasons you start to see a tremendous amount of benefit. Oxygen goes into the cell better with the activity of the pulse magnetic field. ATP is generated in mitochondria. Carbon dioxide and water are able to actually more effectively, more efficiently exit the cell. So again, the metabolic waste that built up inside the cell now can begin to move out of it. That's, again, the primary basis behind pulsating fields being more, if you will, stronger acting on the body than static fields. This is a pictogram of the kind of fields that the head produces. Now, you have to blank out the Earth's magnetic field in order to study the native fields of the cells themselves and the organs themselves. And there's a whole science on this, and this is actually one of the original sort of sciences, the bodies of scientific knowledge that developed around magnetic fields, is what the body is producing itself. Only now are we beginning to use this in a clinical application, used primarily in magnetoencephalography. And neurosurgeons are using magnetoencephalography to identify structures in the brain, the epileptic structures in the brain, to be able to put probes into those structures and then do surgical ablation of the lesion that's producing these seizure discharges. But the fields around the head, the magnetic fields around the head, are very, very complex. This is give you a sense of the kind of magnetic induction, the fields that are produced by different structures within the body. The heart, of course, produces the strongest. It's a beating muscle. There's a tremendous amount of charge activity in muscle, particularly calcium, again, ionic calcium. Oculogram, muscle. Myogram, muscle. Cardiogram, muscle. Now, this is all electrical neural conductivity, but muscle in the body tends to produce the strongest magnetic fields. Another reason why the great physiological concept, if you don't use it, you lose it. Okay, by generating charge, you're creating amplification of fields in the tissues. Those fields generate have all kinds of secondary effects. So things that are static, that are not in motion on the surface of the planet, are not generating charge and don't heal. Healers produce a range of different frequencies. This is what happens with a healer before, with a healer during. These slides are from Oshman's book. But during a healing process with a healer, you can get a tremendous variation in the amount of frequencies that are produced from the healer's hands. Concepts, and I'm not in complete agreement with these ideas that two cycles is required for nerve regeneration, and 7 for bone, and 10 for ligaments, and 15 for capillaries. I think this could be predominant, and there are what we call windows, and there are areas where you have maximum effects. But if you put a static magnet on the body and you don't know what's going to happen, you're still going to get effects. It may not be the kind of effect that you want. For example, if the pain structure in the body is 3 inches into the body, remember we talked about the field dropping off. Well, it's going to take a lot longer to get impact on those pain structures to reduce the pain than it is if the structure is only a quarter of an inch into the body. So if a static magnet that's put on the body is not working, it's not because it doesn't work. It's probably because it's not strong enough for the problem tissue that you're dealing with, the problem that you're dealing with. Again, different structures in the body produce their own frequencies and produce their own field strengths. Even the beating of the heart as it beats a column of blood through the tissues, is a charge carrier. There's a wave of electrolytes that is moving through the blood vessels at that time. That wave of electromagnetic activity, what's it doing? Again, the motion of that wave is creating changes within the tissues even as it goes along. Never mind the oxygen, never mind everything else that's happening. So in my mind, putting a magnetic field, a pulse magnetic field on the body is like throwing a rock in a pond. The rock drops to the bottom of the pond, but the waves go on and on and on. So if you start with 2 cycles per second, if you start with 2 hertz or 10 hertz, or you have a complex field like the QRS is that has 3 different settings in it, 3 different frequencies in it, those frequencies then continue up through their harmonic scales, up and down. If you start with 50, you'll get cycling, you'll get harmonics going from 50 up, but you also get harmonics going back down. So you don't necessarily need to cover the whole spectrum, EM spectrum, to produce effects. The harmonics themselves take care of a lot of that. Obviously, the strongest effects are going to be at that particular frequency, the frequency that you're subjecting the body to at that moment. But again, over time, you continue to get benefits. So I like to stagger my treatments. When I tell people to use pulse field systems, I like them to separate the treatments by 6 to 8 hours. Let those systems reverberate through the tissues. Let the wave go on and do what it's going to do. Let things settle back down again. Anytime you expose a system, as Jim said, to a continuing signal, it begins to start to ignore the signal. And so you have to let it rest again, and then the next time you expose it again, you are probably exposing it at a different level of function. If you this happens in acupuncture too, you start a course of acupuncture treatment, and you're doing treatment for maybe 10 sessions. For the first week, you're doing maybe 3-4 treatments. The next week, you're doing 3 treatments. The week after that, you're doing 2 treatments. And then you gradually spread the treatments out. But what we have to find out, though, is what the appropriate interval is in order to maintain the benefit. And that's still something that, obviously we are learning about. Okay, PEMFs are not natural to the body. Now, one of the things we don't know, and I did mention that PEMFs, we don't know what the lower limit is. We just don't know what the lower limit is. With static magnets, we do. It's the background field. But with PEMFs, we don't know what the lower limit is. But as Jim said, the lower the limit is, the lower you go with pulse fields, even though you still get effects, they are only going to be as good as the ambient field. If you happen to be sitting in front of a computer monitor and you've got a pulse magnetic field system that is weaker than the computer monitor, then obviously the monitor is going to do more to your body at that time than the magnetic therapy you did before that. So there are some magnetic systems now that have been FDA approved that are in picotesla fields. They're extraordinarily expensive as well. But there's a big problem with them because of the fact that you can quickly undo the benefit of it just by going out into the world. You probably can even undo the benefit of it by getting in your car if your car has radial tires. Because the motion of the radial tire is generating EMF. The radio in your car is generating EMF, right? The air conditioning in your car is generating EMF. The vibrations set up by the car itself, or the road in the box, the metal box that you're riding in, generates EMF. Right? So the weaker the field, sometimes you get lost in all the other noise. So even short exposures to very weak frequency fields produce physiologic healing actions at the cellular, hormonal, and energetic levels of the body. There are lots of advantages and reasons why pulse magnetic fields or magnetic fields are a great therapy system to the body. How do they work, basically? And I think they work at multiple levels, and this is just a short list of the kinds of possibilities in terms of what magnetic fields do. I think they work on the general biofield. We've heard some discussion about that. They definitely work through the acupuncture systems. I had my own personal experiences with this, and we did some tests on that, and it does show that they do work through the acupuncture system. It makes sense if it's a DC current system. So magnetic fields and electric fields interact all the time. It definitely affects the autonomic nervous system, affects molecules, ion movements. We know that pulse magnetic fields, there's tons of research that shows that pulse magnetic fields stimulate RNA and DNA, nerves, brain, the water, and all the chemical reactivity that's in the tissues. Eastern Europeans use the magnetic fields along the spine just to stimulate the ANS, the autonomic nervous system. You can rebalance the blood flow to an organ, the organ can heal itself. So you don't necessarily have to aim it at the tissue itself directly. You can aim it, and this is what acupuncture does, often indirectly. Put a needle up here and you affect your hemorrhoids. Right? With the spine itself, you do the same thing. So I will sometimes actually put a magnet or have somebody wear a magnetic necklace, which is easy to wear, to affect problems in their legs, because it rebalances the meridians. But you're getting anything in the neck is going to get any traffic in the spine, it's going below that level, isn't it? So you can treat the lower back. So people have magnets they wear under the belt. So you get the lower back. Everything under that level is going to, of course, benefit the tissues below that level. I did some tests using EAV equipment with the magnetic fields, and what we found is, sorry, let me go back here. There we go, thank you. This is an initial EAV evaluation of a subject. You can see the yellows and the reds. Green is balanced, red is out of balance. You subject somebody then to an 8-minute treatment on a magnetic field mattress, the QRS system, and this is what you get. Look at that. Right? That's one subject. And here's another subject. Similar sort of thing, lots of reds, yellows. Somebody has not had any kind of acupuncture treatment, any other kind of sort of natural medical treatment. And then you re-examine them after a magnetic field exposure. Again, look at the clearing. So magnetic fields act initially on acupuncture systems to shake the ashes off the embers. Acupuncturists get very confused very easily, and so do the EAV practitioners, because they're dealing with a lot of noise. So until they clean everything out, you won't be able to get at the fundamental meridians or points that are out of whack. Pulse magnetic fields can do that for you, in addition to doing the treatments. This is an aura done with the aura video station. This is somebody who had that done, and then they were exposed for 8 minutes to a QRS system. This is sort of what happened to their aura. So there's a generalized field response in the body with the magnetic exposures as well. Okay, and magnetic fields are complementary to other systems. Now this slide is really critical to the whole process, and this slide and the next slide are in our book. This is sort of like a summary of the physiologic effects of the magnetic fields. And I tell people that magnetic therapy is not oriented to a disease. It's a physiologic treatment program. Most diseases carry certain elements of imbalances together. Edema is very common. Lack of circulation is very common. Nerve firing or overfiring is very common. Underfiring, overfiring. So a lot of these pathologies are all based on individual physiologic responses. There's a limited repertoire of physiologic responses in the body. We call it a disease by the pattern of physiologic imbalances that occur in that particular disease. So what we're doing with magnetics is we're fixing some of the physiologic responses. You fix that, you fix the disease. It's a strange way of thinking about things, isn't it? So what we're doing, but with magnetic fields, as I said, we're creating current. As we create current, we do create free radicals. Now that's a bad thing. Just remember that every time we take a breath, we create free radicals. But that's why we have antioxidant systems in our body, to dampen that out. So you have to balance the free radical that you're producing with the antioxidant systems of the body, and hopefully you have adequate nutrition that is not overwhelming that on a continuing basis. So you have to support that as well. But you do create SOD, superoxide dismutase, the natural systems of the body to take care of that. And then that produces then the magnetic fields. Because of the secondary effects on the antioxidant system being stimulated, you produce anti-inflammatory effects. But with current, again, you're affecting the cell membrane. Once you start to stimulate the cell membrane, then you improve cellular respiration. We mentioned that. You start moving calcium, you start moving nitric oxide, prostaglandins, and so on. So from there, you can get perfusion changes. You start affecting the coagulation system of the body. You start to immunomodulate. You create cyclic AMP and GMP, so you accelerate healing processes. Right? So then these are the basic actions, some of the basic actions, not all of them of course, but some of the basic actions. You reduce the spasm of muscles, you reduce pain, you reduce edema, you improve perfusion, you accelerate healing, and you create an anti-inflammatory action. This is established in the science. This is in the literature, in humans, not just in animals. So this is established in humans. But what happens, we talk about when you prick your finger, where does it hurt? It hurts in the whole body. It doesn't just hurt your finger. That may be where it started, but the whole body is now harmed, if you will, by that event. Same thing happens with magnetic fields. Once you stimulate a local area, if I put a little magnet on my fingertip, the action is not just limited to my fingertip. And I see this all the time. You put a static magnet in somebody's palm, and you measure the vascular response in their right hand. You get a vascular response in the right hand. So the whole body begins to vasodilate from that one small action. With electrical currents then, what you're doing is you're stimulating all these biological membranes, which affects excitative structures in the body, the nervous system essentially of the body. Then to the CNS. So it starts with the periphery, moves to the CNS, goes to the pituitary, okay, which then drops back down again and affects thyroid, TSH, affects ACTH. All right? When you do those, when you affect the thyroid, you affect cellular respiration. When you affect ACTH, immunomodulation. The CNS itself affects the vagus system, so you get parasympathetic activity, okay, which then can drop blood pressures. All right, but then this column of activity obviously cascades over into this column, and so what do you get? From a local response where you have anti-inflammatory action, healing action, perfusion changes, anti-edema, analgesia, and myorelaxation, now it cascades to the whole organism. So it's no longer limited to the local area of treatment. Okay, this is the exciting thing about magnetic fields in terms of what they do to get us better. And again, some of these are summarized in our book. There's a phenomenon that occurs in magnetics that occurs in other healing systems too, and that is that you do get an increase in inflammation sometimes temporarily from the magnetic field. Because of the increase in free radicals, the increase in circulation, you can have a temporary worsening. I call that climbing the hill to get to the other side. You can see here that you get an increased inflammatory response after 2 to 3 days of magnetotherapy. So if you have somebody who's got a hot rheumatoid, a really hot autoimmune process going on, you have to be much more gentle because you're going to aggravate that significantly potentially and sometimes destabilize somebody. So I warn everybody that I'm treating that there's a possibility, and I have no way of knowing what kind of pathology they have and what the levels of imbalance at this point. We have to get the instrumentation to be able to do this, what the level of imbalances are in the body, so that then you can move ahead through that progression of healing and eventually create cellular repair. On the website, there's a tab called Treatment Basics, and I go through a lot of the information in there about the levels of healing and what you can expect. People want instantaneous responses. So obviously some things improve very quickly because they're very easily budged or moved, and those are at the energetic level. The 4 levels that I define, for simplicity, as a family physician, this is my constructs model, is that you move it from the energetic level to the physiologic level, and you move it from physiologic level to the pathophysiologic level, because there's still some level of imbalance there. And then eventually, if you don't get it before that level, then you end up with pathology. Pathology is cellular death, organ death, or whole person death.